I'm Dr. Christopher Bates. I'm a plastic surgeon here at Ponte Vedra Plastic Surgery. Today I'm here to talk about liposuction. So liposuction is a very broad topic, and I will try to make it as easy as possible. So I have a lot of patients that come in that are interested in what is called body contouring, whether it's just to give them a little more shape, or if it's a little pocket of fat or an area that is bulging that just bothers them that they just can't seem to work out, whether it's doing exercises or it's just always been there. Sometimes people are just born with certain areas that are a little bit larger than they would like. And again, most people will come in and they'll say that they've been working out for a long time and they just can't get this area to get better. And that's where things like liposuction come into play. The other patients that come in also are patients that have maybe gained some weight or lost some weight and still have some stubborn areas. Or the particular patient is, let's say, a mother that's had children, or somebody that throughout time has again gained a little bit of weight, but they're not quite a candidate for more invasive procedures like a tummy tuck or the mommy makeover like we've talked about previously. So the ideal patient that comes in is someone that really they do have just some extra fat in whichever area is of concern for them, and they have good skin turgor or very little skin laxity, meaning that their skin is basically tight, and I know that once I do liposuction that they will very likely that their skin will shrink in and stick and have a really nice contour afterward. Which brings up the topic of those people that are not good candidates for liposuction, or those that do have a lot of skin laxity. Sometimes people that have lost a lot of weight, or patients that have had children. Sometimes their skin has just become lax. They may be very thin nonetheless, or just have a little bit of troubling areas, but liposuction can potentially worsen their skin laxity. And I have a really thorough conversation with these patients that I truly don't think that liposuction is the right procedure for them and that we need to talk more invasive things. So liposuction itself is done with a cannula, and this is all done under general anesthesia. There are sometimes exceptions when there are small areas that can be done under local anesthesia, but typically everything you're asleep for. And we use a cannula insertion site with a little tiny poke hole, depending on the area involved, and we basically infiltrate with some local anesthetic that helps numb the area as well as decrease bleeding. And we use a liposuction cannula to suck out the fat. People may wonder where liposuction can be performed. It really honestly can be performed almost anywhere. Obviously, depending on your troubling areas, the amount of skin laxity, and of course our knowledge of the body's anatomy, which areas of skin are more likely to become lax versus others. And then of course general things of nerves and arteries and veins that we don't want to get close to. But most commonly things like the tummy, whether it be the upper tummy above the ribs or the lower abdomen, the flanks and love handles, the back, including the upper back, lower back, arms, thighs, on the inside and outside, even on the back as well as the front of the thighs. Banana rolls, as some people call the little roll that sometimes forms under the buttock. Really, you can get liposuction anywhere. Liposuction, it's not that easy. You have to recover from it. People think because it's less invasive than surgery with cuts that they're just going to kind of bounce back immediately. And don't get me wrong, people bounce back pretty quickly, but there's a lot of upkeep involved. And most notably, compression is super important. I can't emphasize that enough with my patients, because I always tell them 50% of the job is me doing the lipo, and the other 50% is them being very good with their compression. And what that does is that helps squeeze out all the excess fluid from the liposuction and helps kind of mold and contour their body, as well as provide good compression to help the skin stick down better. So compression is very, very important. Another portion of this is that their actual recovery takes a good 3+ months, sometimes up to 6 months for the swelling to completely resolve. So I'll have a lot of people come in saying I still look bloated, or after I've been working out, I get more bloated. This is very common for swelling to wax and wane, particularly for the first 3 to 6 months, and then it usually kind of subsides after all of that. So these are just kind of basic expectations after liposuction. As for actual recovery itself, most people will take a week off from work. After that, as long as of course they're wearing their compression garments and can go work, it's pretty much as tolerated recovery program, and most people are completely fine by a month out. I also do recommend people get lymphatic massages after their liposuction. Usually starts at about a week out after the procedure, and sometimes they'll meet twice, sometimes just once a week, usually for about a month or so after the procedure, and that just expeditiously moves the swelling and also the fat that has been liposucked or anything that was left behind toward the lymphatic system and out, and helps expedite their recovery. So I'm a big believer in it, and my patients seem to really like it. If you're interested in liposuction, feel free to come see me or the other 4 partners here at Ponte Vedra Plastic Surgery. You can call us at 904-273-6200 or visit us online at pvps.com.